Today's presentation will focus on depression and anxiety. Today's topic has been explored a lot, but not enough. It's become common cold in New Age. When we compare statistics from United States and Canada, we can see how much $1 billion are spent on managing these disorders and percentage of the population that will suffer from mood disorders and anxiety in their lifespan. When we talk about US statistics, $40 billion are spent on managing these disorders. 10% of the population will suffer from mood disorders and 20% from anxiety, with a lifetime increase of 10%. When we talk about Canada statistics, $32 billion are spent on managing these disorders, and as being most prevalent disorder in the country, 50 to 85% of individuals have the lifetime relapse. When we talk about diagnostic challenges, unfortunately there is no diagnostic test such as scans or lab works to help us understand disease process. However, some MRI scans shows that hippocampus in the brain is slightly smaller in individuals affected with these disorders. As previously stated, due to lack of diagnostics, researchers came up with different theories in development of these disorders. One theory is solely based on genetic and environmental factors. The second one is stating that depression is actually not a disorder, but rather a response to life events. And the third one is behavioral point of view. This theory is stating that these disorders are not adaptive, but rather become unregulated due to life events. Additionally, the genetic component of these disorders contributes to 30 to 40%, and environmental factors are 60 to 70% of diagnosed population. Furthermore, when we talk about genetic predisposition to depression and anxiety, the brain as a mood regulator is the most crucial element. Nerve connection, nerve growth, and nerve circuits in the brain are predominantly responsible for developing these disorders. For that reason, not one person has the same symptoms of anxiety or depression. Although depression and anxiety manifest with similar symptoms, the process is different. While individuals with depression focus more on the past losses and negative thoughts about self, world, and future, anxious people are more concentrated on future harm and danger. Therefore, worry is a predominant symptom with both disorders. However, content is different. Therefore, people with these disorders share a similar genetic vulnerability or have one condition being an extension of the other.
Characteristics and symptoms of depression. The term depression comes from the Latin term deprimere, meaning to press down. Deprimere is also an umbrella term for feelings such as sadness, dread, and unhappiness. This is also how anyone with depression, otherwise known as major depressive disorder, would feel. Some of the primary symptoms that are associated with depression include feeling hopeless, irritable, frustrated, tired, and having severe negative thoughts. It is important to keep in mind that symptoms of depression may vary for different ages. Signs and symptoms for younger children include sadness, clinginess, being underweight, and refusing to go to school. Teens may experience anger, worthlessness, irritability, sadness, and oversensitivity, which further leads to dependence on substances as a way to cope with how they are feeling. Adults experience changes in memory and personality, extreme fatigue, insomnia, loss of interest not caused by a medical condition, or suicidal thoughts, which are more prevalent in older men. Additionally, people who suffer from depression may feel a loss of appetite. This is further explained as anorexia, another psychological disorder. Anorexia is one of the most prevalent early signs of depression, or if a person is recovering from depression, anorexia may be a sign of relapse. On the other hand, some people who suffer from depression may overeat, which is explained as binge eating disorder. Binge eating is prevalent for some people who suffer from depression and feel the need to eat more as a coping method for their depression. This could be continuous eating, even when full, eating normally in front of others but binging when alone, and inability to control what is eaten. It is important to monitor eating habits, as eating habits are early signs of depression or relapse, as mentioned above. Characteristics and symptoms of anxiety. Anxiety is the most prevalent mental health condition, yet the most hidden condition among all ages. There are various types of anxiety disorders, including but not limited to panic disorder, which is defined as feeling anxious for no reason, social phobias, defined as an intense fear of being judged by others, post-traumatic stress disorder, defined as a fear of a traumatic event reoccurring, and obsessive-compulsive disorder, which is defined as the desire to have everything in order. Despite being the most prevalent mental health condition, anxiety is not given as much attention as other mental and psychological disorders, which in turn allows many individuals who suffer from anxiety to believe that it is normal and can be treated over time without the need of professional help. The primary symptoms of general anxiety disorder include constant tension, sweaty palms, anxious worrying, increased heart rate, or fears of things that take place every day, such as leaving home, seeing friends or family, or receiving a phone call. Really, everyone faces some sort of anxiety at some point in their lives, such as the anxious feeling before a big presentation, or feeling uneasy before a big day, such as a wedding or a big birthday party. But when the symptoms are constant and do not go away on their own, this is a warning sign that a person may be developing an anxiety disorder. Panic disorder, one of the most common anxiety disorders, is characterized by repeated, unexpected panic attacks with both physical and mental manifestations. Panic disorders are among the anxiety disorders that are known as complex genetic diseases and are generally characterized by pathogenetic environmental factors. As per this definition, various life events can contribute to the incidence of panic disorder in one's life, such as sexual or physical abuse, neglect, chronic illness, traumatic events, the passing of someone close, or separation or divorce. On the other hand, genetic factors may have an effect on one's anxiety. For example, neuronal structures in the brain play a role in the way a person responds to a situation. This type of neuronal gene may be passed down to offspring during the fetal stage. Overall, depression and anxiety are considered to be heavily impacted by socio-environmental factors. Many social determinants of health, including but not limited to the quality of housing, gender inequity, presence or absence of resources, that is, hospitals, public transportation, and more, neighborhood, and education, all have an impact on one's life and the prevalence of depression and anxiety in a society. Additionally, if there are further biological factors, such as gene infrequency or poor metabolism and the presence of chronic illness, then the risk of developing depression and anxiety is much higher as well. As demonstrated in this pie chart, 23% of the Toronto population indicate that neighborhood is the biggest factor contributing to depression and anxiety, 20% indicate housing as a predominant factor, 25% indicate gender inequity, 15% indicate accessibility to resources, and 17% indicate lack of education as the leading cause for depression and anxiety.
Anxiety disorders are the most common form of psychiatric illnesses. Anxiety disorders affect 1/3 of community at some point of their life, according to the epidemiological studies. Anxiety disorders are likely to be caused by a complex mix of biological and environmental factors, as it is the case with many mental health diseases. Long-term unemployment, living in an abusive or uncaring relationship, long-term isolation or loneliness, and chronic work stress are all more likely to cause depression and anxiety. Depression is a medical condition that affects the brain and, as a result, the rest of the body. Anyone can be affected with depression, including children, adolescents, young adults, middle-aged individuals, and elderly. 20% of individuals and adults will experience depression at some point in their lives. Depression and anxiety is the far most frequent medical condition in men, according to some epidemiological studies. A clinically severe depressive disorder affects up to 4% of men and 8% of women, and this including depressed and anxiety symptoms being far more frequent. A mix of biopsychosocial variables appear to be the cause of some anxiety disorders. Clinically significant syndromes are produced when genetic vulnerability interacts with stressful or traumatic events. Anxiety can be caused by the following conditions: medications, herbal medications, substance abuse, trauma, childhood experiences, and panic disorders. In the general population, anxiety is one of the most frequent psychiatric diseases. Specifically, phobia is the most common, with a prevalence rate of 12.1% in over a 12-month period. There are many different types of depression. Clinical depression is known as a major depressive disorder that is a more severe form of depression. It isn't the same as a depression that is brought on by a loss, such as a loved one's death, or by a medical condition such as the thyroid issues. Stressful events generate depression in those who are vulnerable due to biological and psychosocial features. In population-based samples, there is a significant occurrence of comorbid issues and depressive illnesses. Adults in Canada have been shown to have a lifetime prevalence of anxiety disorders and major depression of 28.8% and 16.6% respectively. Depression is linked to every anxiety condition, which has the strongest links found in individuals with generalized anxiety disorders, also known as GAD. Overall, environmental influences are thought to have significant impact on sadness and anxiety. Many detriments of health have an impact on one's prevalence of depression and anxiety in a society. This can include housing quality, gender inequality, the presence or lack of medical resources, and education. Did you know that anxiety and depressive disorders are the most common mental illness in Canada, affecting 40 million adults in Canada age 18 and older, or 18.1% of the population every year? Anxiety disorders are highly treatable, yet only 39.9% of those suffering receive treatment. Anxiety disorders develop from a complex set of risk factors, including genetics, brain chemistry, personality, and life events.
Now we will discuss treatment approaches. Depression and anxiety disorders are widespread health conditions that remain poorly diagnosed and inadequately treated. The management of both depression and anxiety involves careful examination to determine appropriate diagnosis for each illness. Individuals with anxiety disorders frequently encounter periods of depression, and those who have depression commonly experience anxiety disorders as well. For this reason, it is oftentimes challenging to differentiate between the two health conditions. However, it is crucial for healthcare professionals to not only be able to recognize what a patient is diagnosed with, but to also be able to provide available treatment options and appropriately care for individuals living with both illnesses. Treatments today are available for individuals who experience depression that occurs alone, as well as when it co-occurs with other medical illnesses. In response to depression and anxiety disorders being some of the most prevalent mental health conditions today, robust bodies of research on both medical and non-medical approaches are continuously studied to determine the degrees of effectiveness varying treatments have on these specific disorders. In terms of non-medical approaches, a number of studies suggest that exercising and increasing physical activity is beneficial to one's mental health and physical well-being, providing positive effects on mood and anxiety. The first line of treatment for symptoms of depression that are mild to moderate is in fact incorporating exercise into one's daily routine. In addition to exercise, cognitive behavioral therapy and interpersonal psychotherapy are also used as non-medical treatments for mild to moderate mental health conditions. Such therapies provide an alternative approach to antidepressant medications that have been proven to be efficient for less severe cases of depression and anxiety. Now, in terms of exercise, which is a primary non-medical approach to reduce depressive and anxiety symptoms, adequate physical activity has actually been proven to enhance mental well-being, improve life satisfaction, and advance cognitive functioning. In contrast, physical inactivity is associated with the occurrence of psychological disorders. Research has found that those who are physically active have a lower risk of developing various diseases and disorders, reducing the risks of multiple depressive symptoms. It is important to keep in mind that those living with mental health conditions, such as depression and anxiety, often experience passivity and withdrawal, in which individuals may feel reluctant to be physically active compared to the general population. Therefore, although it may be challenging for patients to reduce sedentary behavior and be able to get up and move around, prospective studies have actually concluded that patients who try their best to perform aerobic exercise routinely had significant improvement in their mental health and well-being compared to those who do not take part in exercise interventions. Although these interventions are not as effective as pharmaceuticals and medical approaches for extreme cases, most of the non-medical approaches are cost-efficient treatments with no side effects in comparison to active drugs and are actually found to be effective in improving minor depressive symptoms, as well as various anxiety disorders. In terms of medical approaches, the diagnosis of major depression and chronic anxiety disorders are often fundamentally clinical. Careful investigations and laboratory tests are conducted in medical interventions to determine which medications are effective treatments for depression and anxiety. Some psychotropic medications include antidepressants, anxiolytics, mood stabilizers, stimulants, and antipsychotics. In specific, antidepressants, which are the most commonly handled in medical treatments, are used to restore chemical imbalances such as a lack of norepinephrine or serotonin in the brain. Studies have shown that several patients with depression and anxiety have reported substantial improvement after taking these specific medications. Over several years, numerous studies have been conducted to propose new treatments for mental health conditions. The most recent medications incorporate a stronger patient adherence, clear dosing strategy, and a decreased risk of death if overdose were to occur compared to the older drugs that are used universally. These 9 newer antidepressants include citalopram, bupropion, fluoxetine, venlafaxine, nifazodone, sertraline, mirtazapine, fluvoxamine, and paroxetine. Although these pharmaceutical drugs are currently among the most commonly prescribed medications for depression today, they still present risks when used with other medications and pose delays in full therapeutic actions. In addition to the known treatments currently available for depression, in 2021, researchers from the Icahn School of Medicine at Mount Sinai have conducted a randomized placebo-controlled study to determine the efficacy of a new drug called ezogabine on decreasing depression levels. The drug works by opening the KCNQ23 potassium channels in an individual's brain, controlling the flow of electrical currents across neurons, improving symptoms of depression and anhedonia. The study concluded that those who were treated with ezogabine demonstrated a significant reduction in several measures of depression compared to individuals who received the placebo treatment.
So now we're going to discuss the presence of anxiety and depression in the media. Over the years, there has been more media attention when it comes to mental illness, although the depiction of some of these disorders is not accurate. A study conducted showed that the mass media, such as TV shows, movies, and the news, are the main sources from which the public receives information about various mental illnesses like depression and anxiety. Depression has been portrayed in the media since the mid-1900s. The presence of depression and anxiety in the media is often riddled with misinformation that can lead to a public stigma. The stereotypical information provided in the media means that many people gain an inaccurate view of those with disorders. It causes individuals to receive negative attention due to fear and prejudice. There are certain consequences caused by the negative media portrayal for individuals who have mental illnesses. Some of these consequences are that they impair self-esteem, help-seeking behaviors, medication adherence, and overall recovery. Previous research that focused on treatment seeking has demonstrated that those with high levels of self-stigma often feel less inclined to seek help from a professional. Mental health advocates blame the media for promoting stigma and discrimination towards people with a mental illness. Listed are some common stigmas that have been created about depression and anxiety by the media. So the first one is that all people with depression are suicidal. This is not true. Having major depression does increase an individual's suicidal risk, but some people who have depression are not suicidal. Not all people with depression will show the same symptoms or have them to the same degree. The media does not represent the complexity of the mental illness. There's the sense that it's just a one title fits everyone. A show that misrepresents depression and anxiety is 13 Reasons Why. It is about a teenage girl by the name of Hannah Baker who commits suicide and leaves behind 13 tape recordings about the 13 reasons why she decided to commit suicide. In the show, Hannah's classmates constantly say Hannah's life was no worse than anyone else's. She was just a drama queen who wanted attention. This statement gives off the idea that individuals who have a good life should not be depressed. This is a perception that many individuals believe about people with mental illness due to the media. While some life events can aggravate depression, it is first and foremost a problem in the chemistry of the brain. Although the show never mentions anything about Hannah's mental health and portrays that her suicide is a direct result of things that happened to her. This is a misconception as the show validates that depression and suicide are reactions to only external factors and has nothing to do with internal factors. Additionally, the show follows the depiction of people with depression look a certain way. In the show, it was perceived that people who dress in colorful clothes, have friends, and get good grades could not have depression. An individual does not have to fit a certain image based on their looks for them to have depression or not. Overall, 13 Reasons Why gives an inaccurate and toxic picture of the mental illness that it was supposed to help spread awareness about. Another example is the movie Airplane. This comedy film is about ex-fighter pilot Ted Stryker's fear of flying, so he has PTSD. He gets on a plane to try to win back the love of his life, who is part of the flight crew. When both pilots get sick with food poisoning, Ted must overcome his anxiety to safely land the plane. Due to his PTSD and anxiety, Ted has a serious drinking problem and has not been able to adjust back to normal life. He is desperate to try and save his relationship, so Ted swallows a handful of anxiety medication and is forced to find the courage to land the plane. When he's brought to the cockpit, he's terrified but receives a pep talk which causes him to feel empowered. Ted's newfound confidence and courageous attitude help him win back Elaine. This film is an inaccurate representation of what anxiety really is. Taking a handful of anxiety medication will not help an individual get rid of their mental illness instantly. The media has also caused individuals to believe that people with anxiety could just snap out of it if they wanted to, which is portrayed in the film. It takes time for an individual to recover from their anxiety and PTSD. Additionally, in the film there are some scenes that make fun of the symptoms of anxiety, such as sweating. For example, there is a scene where he's soaked from all his sweat because he's anxious from flying the plane. This is a dramatic and distorted image of what the symptom is really like. The mental illness of anxiety and PTSD is used in an exaggerated way to create a comedic relief and a more interesting storyline.
In summary, depression and anxiety are mental health disorders that are affected by a number of factors and have a drastic impact on one's life, It is important that we as a community work together to stop the stigma and break the barriers surrounding mental health.